HIV is the name of the virus that causes AIDS. AIDS destroys the immune system. As a result, the body loses its resistance to the penetration of viruses, bacteria, parasites, pollutants, carcinogens, toxins and fungi. HIV is a viral infection that can be transmitted through sexual contact, blood, or mother-to-child during pregnancy, at birth, or during breastfeeding. A person may have been infected with HIV for several years before becoming infected with AIDS. Unfortunately, there is no cure for AIDS, but there are drugs that can dramatically slow the progression of the disease. Symptoms of AIDS. The first few weeks after being infected with HIV are called the acute phase. During these weeks, the virus multiplies rapidly, and the immune system tries to respond to the infection by producing antibodies against HIV. About half of those who become newly infected with the HIV virus develop flu-like symptoms within 2 to 4 weeks. Symptoms include fever, sore throat, upset stomach, fatigue, skin disorders such as itching or irritation of the skin, muscle and joint pain, headache, and swelling of the lymph nodes, mostly on the neck. Symptoms that appear latent phase. Weight loss. Oral infection. Diarrhea and vomiting. Sweating at night. Persistent fever. Kidney disease. Nervous problems. Recurrent fungal infections in the mouth and vagina. Pneumonia. The final symptoms or stage of a person becoming infected with AIDS. Frequent fever. Occurrence of opportunistic infections. Swollen lymph nodes, especially in the axilla, neck and groin. Chronic fatigue. Night sweats. Dark spots on the skin, mouth, nose or eyelids. Wounds, blemishes or lesions of the mouth and tongue. Genital or anal ulcers. Skin lesions and rashes. Frequent and chronic diarrhea. Sudden weight loss. Neurological problems such as difficulty concentrating, memory loss and confusion. Stress and depression. Does a positive HIV test mean death? You should know that anyone who is infected with HIV and tested positive for HIV is not considered HIV positive. When a person infected with HIV is diagnosed with HIV, either the absolute number of CD4 cells, a group of the body's defense cells, is less than 200 per cubic millimeter of blood, or opportunistic infections caused by factors that can cause disease in healthy people has occurred in the person. In some people, the onset of symptoms may even occur 10 years later. Ways of transmission. To cause HIV infection, contaminated blood, semen or vaginal discharge must enter your body. You will not become infected through normal contact. Hugging, kissing, dancing or shaking hands with someone who has HIV or AIDS does not make you infected with the virus. Through sex. If you have had vaginal, anal, or oral sex with an infected person and that person's blood, semen, or vaginal fluid enters your body, you may be infected with the virus. The virus can enter a person's body through mouth sores or small droplets, sometimes in the rectum, the end of the large intestine, or vagina during sexual activity. Using a common needle. Any type of surgery, endoscopy, device dialysis, dentistry, circumcision, cupping, injections, and acupuncture that does not fully sterilize the equipment can transmit HIV and other viruses from one person to another. During pregnancy or at birth or during breastfeeding. An HIV-infected mother may also infect her own child with the virus. But by receiving treatments for HIV infection during pregnancy, the risk of mother-to-child infection is dramatically reduced, and breastfeeding HIV-positive mothers are prohibited from giving their children the virus is also secreted and transmitted in milk. Donation of HIV-infected blood. Blood, semen, vaginal discharge, breast milk, and any other fluid in the body that contains blood generally transmit the virus. Saliva, tears and sweat do not contain HIV. The HIV virus is not transmitted through pets and mosquito bites. AIDS cannot be transmitted in the following ways. 1. Normal contact of people with the patient at home or in the community. 2. Shaking hands. 3. Using common eating utensils such as plates, glasses, spoons and forks and 4. Using public pools or public toilets. 5. Hugging or kissing the face. 6. Sneezing and coughing. 7. Door handle, telephone and bus bar. 8. Using used clothes. 9. Water and food. 10. Contact with the patient's tears and sweat. 11. Using a common vehicle. 12. Insect bites. People with AIDS should observe the following. Eat healthy. Eating fruits, vegetables, nuts and lean protein is essential. It promotes healthy eating, body and immune system. Avoid unpasteurized dairy products, raw eggs and raw seafood such as oysters and sushi. Cook meat thoroughly. The vaccine used for HIV-infected patients should not contain a live virus, as it is dangerous for people with weakened immune systems to take care of pets. Some of these animals may have parasites that can cause infections in people with HIV. Create. Cat feces cause toxoplasmosis, reptiles carry salmonella, and birds can carry cryptococcus or histoplasmosis. Wash your hands thoroughly after contact with pets or emptying the trash. Golden tips. Only have one partner for sex, have protected sex and use a condom. Use a disposable needle for injection. If you have high-risk behavior, the first test should be done 2 months after the high-risk behavior and the second test 6 months after the high-risk behavior to make sure you are not. Not everyone living with HIV is necessarily infected with AIDS, but must meet certain criteria for being diagnosed with AIDS. The presence of sexually transmitted diseases such as gonorrhea, syphilis, as well as genital ulcers increases the risk of infection. Have a separate toothbrush and razor, and use disposable tools for tattooing. The best way to diagnose is a blood test, and the symptoms cannot be limited to some symptoms: dry cough, enlarged lymph nodes in the armpits, groin and neck, white spots or abnormal spots on the tongue and mouth, severe weight loss, diarrhea and fever, long-term fever, memory loss, and depression are related to another condition. Women infected with the virus are better off avoiding pregnancy.